Good morning friends, welcome on my channel Charming Science. Today we are going to talk about the bone lunate. So whenever we are going to talk about the lunate bone, first we have to know what's the meaning of the lunate. From the Latin word luna, meaning moon, referring to the crescent shape. It was first named as the lunatum in 1653 by Lizer, and it also termed as the lunar or the semi-lunar bone. Whenever we are going to see the lunate bone, we will find that the lunate is a carpal bone or the semi-lunar bone is present in the human hand. It is situated in the center of the proximal carpal bone, which lies between the ulna and the radius of the hand. This is the radius one and this is the ulna one. When we are going to see the lateral and the medial side of relative from the lunate, then we will find that the laterally at the lateral side of the lunate is the scaphoid bone is present, and when we are going to see the medial point, then we will find that the triquetral bone is present. It's at the medial side. When we are going to see the side determination, or we are going to how to determine the sides of the lunate, we will see that the lunate is a crescent shaped carpal bone found within the proximal row of the carpal bones. It is distinguished by its deep concavity and the crescentic outline present on it. So whenever we are going to see the lunate, we have to find the crescentic line or the crescentic shaped structure. This one is the crescentic shaped structure which is present on to the lunate. It is broader anteriorly than its posterior. When we are going to see its anterior view, this is the anterior view. It is broader than the posterior side. The lunate is a crescent shaped with a proximal convex articular facet. When we are going to see the proximal end of the, this is one is the proximal end, the inferior side. The proximal end having a convex articular facet and a distal have a concave articular facet. Whenever we are going to see its medial surface, it's a square shaped. It's a square shaped facet is present on its lateral medial side, and the lateral side we having a semilunar facet is present. Its form, its articulation with the radius, scaphoid, triquetral, capitate and hamate. And along with the scaphoid and the triquetrum bone, it also form the articular surface for of the radiocarpal joint. When we are going to see the bone and its surfaces, then we will find that the proximal surface of the lunate bone is smooth and convex, articulating with the radius. So when we are going to see it's the proximal surface, it's a smooth and convex surface, articulate with the radius, and it's provide its articulating surface with having the triangular fibrocartilage complex. The lateral surface, when we are going to see the lateral surface, we will find that is the semilunar facet with a crescent facet articulation for the scaphoid bone. When we will see its lateral surface is a semilunar facet with the crescentic facet for articulation with the scaphoid bone. The medial surface possesses a smooth and quadrilateral square shaped facet for the articulation with the triquetral bone. The hamate lie distalomedially only in type 2 lunate facet. The distal surface of the bone is deep and concave and it's provide attachment with the capitate and the hamate bone. The palmar surface is rough, the dorsal surface is broad and rounded. So we've determined its sides, articulating surfaces. So whenever we have to see the lunate bone, first of all we will find is the crescentric line. We will form that it is broader anteriorly than its posteriorly. The medial side is square shaped facet and the lateral side surface having a semilunar facet. Whenever we are going to talk about its articulation, then the proximal surface of the lunate is smooth and convex, articulate with the radius. The lateral surface having a semilunar facet, articulate with the scaphoid bone. The medial surface having a quadrilateral square shaped facet, articulating with the triquetral bone, and the distalomedially is articulate with the hamate, and the distal surface of the bone is deep and concave and articulate with the capitate and hamate. We can also see the structures in this image. So if we are going to see the oblique dorsal view of the lunate, then we will find that this surface is lateral surface having a semilunar facet, half facet with a crescentric facet, articulate with the scaphoid bone. We will see it more clearly in this. If we are going to see the medial view, then the medial surface possesses a smooth and quadrilateral attachments. Quadrilateral attachment for the articulation with the triquetral bone. This one is the triquetral bone. Hamate lies distalomedially. When we are going to see the radiocarpal joint, then we will find that it's having a convex surfaces here. When we are going to talk about the muscles attachment, then there are not any muscles which is going to articulate or insert or origin from the lunate bone. When we are going to talk about the ligaments, then there is having a ligament, intrinsic ligament or the extrinsic ligament. The intrinsic ligament is the scapholunate ligament or lunotriquetral ligament, and the extrinsic ligaments is the palmar radiotriquetral ligament, radioscapholunate ligament, ulnolunate ligament is going to present on it. If we are going to talk about its blood supply, then the dorsal intercarpal and radiocarpal arches supply blood to the lunate and form a plexus of vessels located directly over the lunate dorsal pole, and vessels enter into the dorsal aspect of the lunate through one of them foramina. When we are going to talk about the ossifications of the lunate bone, then it starts at the age of 4 and it completes its ossification till 6 and 7 years. The function of the lunate bone is it provides a bony superstructure of the hand, the proximal carpal row, and involved in the movement of the wrist. This is all for the lunate. Thank you.